Hello dear nursing aspirants, welcome to Ganesh Nursing Academy. Today I am going to discuss very important topic, that is types of eye fluids. It is very important topic for examination point of view. You can expect at least one or two questions from this area which is in the nursing foundation. Okay, so let's begin with today's session, that is types of eye fluids. So we can classify here. So types of eye fluids. So there are three main types of eye fluids, that is based upon their tonicity. Based upon the tonicity, eye fluids are classified into three main types, that is isotonic fluids, hypotonic fluids and hypertonic fluids. Okay. So what is isotonic fluids? What is hypertonic fluids? Let us discuss in the next slides. So first one we will discuss about isotonic fluids. Okay. So isotonic fluids means what here? Here these fluids have a same osmolarity like a plasma, and no fluids will shift from blood. No fluid will shift between the cells and blood vessels. Okay, take an example. This is a fluid. Okay, this is a bottle that is containing a eye fluids, that is isotonic fluids. Okay, so here I will draw blood vessels. So this is a blood vessels. Okay, containing a electrolytes. So here the concentration of electrolytes present in the isotonic fluids, these fluids, and the concentration of electrolytes that is present in the blood vessels are same. Okay, that is why they are known as isotonic. Okay, they are known as isotonic because the concentration of electrolytes present in the eye fluids is same like the concentration of electrolytes that is present in the blood or plasma. So because of this, they are known as isotonic fluids. Okay, now so when you administer the isotonic fluids, okay. So when you administer this isotonic fluids, what happens here? There is no, okay. So here the blood vessels are surrounded by the cells. Okay. So when you administer these isotonic fluids, okay, there is a balance between the electrolytes in the cells and the blood vessels, and there is no shift of fluid from blood vessels to the cells or from the cell to the blood vessels. Okay, so there is no fluid shift between the cells and blood vessels. Okay, as these fluids are isotonic, so when you administer these fluids, their concentration or the proportion is same like the fluids that is present in the blood. So because of this, there is no osmotic flow of water content from the blood vessel into the cells or from the cells into the blood vessels. So this is the main advantage of this isotonic fluids, and these isotonic fluids are mainly administered in the case of hypovolemia. Okay, in case of hypovolemia, okay, like a excessive blood loss. Hypovolemia, that is that is caused by excessive blood loss. It may be due to road traffic accident, okay, or it may be due to during the like postpartum hemorrhages, okay, or during the surgical complications, okay, or it can also be administered in the case of dehydration that is caused by diarrhea or vomiting. Dehydration is caused by diarrhea and vomiting. So in this condition we administer this isotonic fluids, where when you administer these fluids, there is no shift of fluid from blood vessel to the cells or from the cells into the blood vessels. Okay, because the proportion of electrolytes present in the fluid is same like the proportion of electrolytes present in the blood or plasma. Okay, and what is the example for these isotonic fluids are? These example for isotonic fluids are 0.9% NaCl, that is known as normal saline. Okay, here in this normal saline, every 100 ml fluid contains 0.9 gram of sodium chloride. Okay, and total it contains how much? It contains 4.5 gram of sodium chloride. Okay, and ringer lactate contains various uh, electrolytes. Okay, it contains sodium chloride 0.6 gram. Okay, it contains sodium chloride 0.6 gram, calcium chloride 0.2. Okay, calcium chloride 0.027 gram. Okay, and potassium chloride, it contains 0.04 gram. Okay, so like this it contains various fluids, okay, various electrolytes in the ringer lactate. And 5% dextrose, it contains merely 5 gram of dextrose in 100 ml. Every 100 ml solution contains 5 gram of dextrose. And okay, so these are the example for isotonic fluids. They are mainly used in the case of hypovolemia due to blood loss. Okay, or it may be blood loss may be because of surgical blood loss during the surgery or road traffic accident, postpartum hemorrhage, or these fluids are also used in the case of dehydration that is caused by diarrhea and vomiting. Okay, so what is the advantage of these fluids? When you administer these fluids, there is no fluid is shifted from either from blood vessel to the cells and from the cells to the blood vessels. That is the main advantage of administering the fluids. Okay, so these fluids can also be administered in the case of burns. Next, hypotonic fluids. Okay, so this is a bottle. You can consider if this is a high fluid bottle. Okay, and here we have a blood vessels. Okay, I will draw on this. This is a blood vessels. Okay, blood vessels containing electrolytes. Okay, here what happens, the concentration of electrolytes present in the fluid is lesser than that of a concentration of fluid that is present in the blood. Okay, so here this is a concentration of fluids, concentration of electrolytes present in the plasma, it is greater than that of fluids here. Okay, so the these fluids have a lower osmolality than the plasma. Okay, and usually when you administer these fluids more, what happens here, they causes hemodilation. When you administer these fluids more, they causes a hemodilation. Okay, so when you administer these drugs, they causes hemodilation, and more dilation means what happens here. So when hemodilation happens, what happens here, I will tell you. So here we have a cells surrounding the blood vessels. Okay, so when you administer more amount of this hypotonic fluids, what happens here, the concentration of fluids, the concentration of electrolyte is less here. Okay, and because of this, what happens here, here the concentration of when you administer these fluids more, what happens here, they causes hemodilation. So because of this, what happens here, there is osmotic flow of fluid from what happens here, from blood vessel to the cells. Okay, so here what happens is the osmosis will take place. Okay, the process of osmosis will take place. So osmosis means what, the fluid will start moving from the region of low solute concentration to the high solute concentration, low solute concentration in the blood vessels to the high solute concentration in the cells. Okay, so because of this, what happens here, this happens because of hemodilation. When you administer these fluids, it causes hemodilation. When hemodilation happens, what happens here, the water content will start shifting from blood vessel into the cells, and this causes mainly brain cell swelling. Okay, it causes mainly brain cell swelling. Okay, brain cell swelling. Okay, that is causes a cerebral edema. It causes what, a cerebral edema. So that is the reason why these kind of fluids, okay, that is a half NS, okay, or even dextrose are not administered in the case of head injury, not administered in the case of a head injury, because they causes what, a osmotic flow of fluid from the blood vessels into the cells and causes swelling of the cells. There will be swelling of the cells will happens here when you administer these drugs. Okay, and in which condition these fluids are administered. Okay, so indication I will tell you. These fluids, okay, these hypotonic fluids are mainly administered, okay, in the case where I will tell you, in the case where there is a dehydration and hypernatremia. Okay, if there is a dehydration, that is concentration of fluid is in the body is less, and there is a hypernatremia. Okay, that is increased sodium level in the blood. Okay, so hypernatremia and dehydration, in that condition, if you administer this fluid, what happens here, this will gradually causes a hemodilation, and it maintain the serum sodium level is also normal level, and it also expand the blood volume. Okay, thereby it prevent the it will correct the dehydration, as well as is also maintain the normal sodium level in the blood. Okay, so mainly this kind of hypotonic fluids are administered in the case of dehydration and increase sodium level or increase plasma osmolarity, okay, in that condition it can be administered. Okay, so example for a hypotonic solution is 0.45% sodium chloride or half NS. Now let us see the hypotonic solution. Okay, this is the third type of solution. Okay, so here if you consider this is a bottle, eye fluid bottle. Okay, and here is the blood vessels. Okay, so here the concentration of solutes present in the fluids, okay, that is fluids, it is greater than the concentration of fluid that is present in the, okay, the concentration of electrolyte is present in the blood vessel. Okay, so what is hypotonic solution? Here the fluids have a higher osmolality than the plasma. Okay, the concentration of electrolytes present in the fluid is greater than that of concentration of electrolytes, okay, that is present in the blood or plasma. Okay, and when you administer these drugs, these kind of fluids, when you administer hypotonic fluids more, what happens here, they increase what is that, they increase the plasma osmolality. When you administer high concentration high solute concentration fluids, when you administer, what happens, they increase the plasma osmolality, okay, plasma osmolarity means what, the concentration of solutes present in the plasma will increases, because already a high concentration so electrolytes containing fluids, where when you administer these kind of fluids, it will increase the plasma osmolality, and because of plasma osmolality, when it increases, what happens here, I will tell you what happens when you administer this kind of fluids more. So what happens here? So there are cells that are surrounding the blood vessels. Okay. So here there is a osmotic flow. Okay, there is osmotic flow of fluid from cells to the blood vessels. There is osmotic flow of fluid from the osmotic flow of water content from the cells. Okay, the water content in the cells will start shifting into the fluids. Okay, usually you know osmosis. So what is osmosis? That is osmosis is nothing but it is a movement of water content from low solute concentration to the high solute concentration. So here when we administer these kind of fluids more to the patients, what happens here? The fluid will start shifting. The water content will start shifting from blood vessels into the from cells into the blood vessels. Okay, so because of this, what happens? It causes cellular dehydration. It causes cellular dehydration. Okay, so cellular dehydration you will lead to what happens? Cellular damage can also happen. Cellular shrinkage can happen. Okay, so that is the reason why these fluids are administered. When these fluids are administered, these fluids are administered whenever the patient is having hemodilution. Okay, in this condition, in which condition it is these fluids are administered? When patient is having a hemodilution and hyponatremia. Okay, that is decreased sodium level. Okay, so when patient is having a high hemodilution, that is high water content in the blood and decreased sodium content. So when you administer 3% NS, what happens here? It just increases the sodium content. It increases sodium content in the blood without increasing the fluid. Because 3% NS is available in a 100 ml bottle. Okay, it is available 100 ml bottle. So when you administer 3% NaCl, it increases sodium level. It increases sodium level in the blood without increasing the blood volume. Okay, so thereby it correct the hyponatremia without increasing the further increasing the blood volume. Okay, so that is why these fluids are administered. Okay, and example for these fluids are DNS, dextrose normal saline. Okay, that is half DNS. Okay, or there is 1/4 DNS is also available. Okay, so 3% NS means every 100 ml contains 3 gram of sodium chloride. So DNS means you know already dextrose 5 gram per 100 ml solution. Okay, and sodium chloride 0.9 gram. Both dextrose and normal saline both are present here. So all of you have to see composition on the fluids. Okay, for your better understanding. And 10% dextrose is nothing but 10 gram of dextrose is present in every 100 ml solution. So total 50 gram is present in 10% dextrose. Total 50 gram of dextrose is present in the fluid. 25% dextrose and 50% dextrose usually available in the form of 100 ml solution. So these fluids are administered mainly in the case of hypoglycemia. Okay, mainly they are administered in the case of hypoglycemia. Okay, so where they very suddenly they improve the blood glucose level. Okay, they administered in the case of hypoglycemia. Okay, this is all about the types of eye fluids. I hope all of you understood this types of eye fluids. So all of you have to remember the example for the types of fluid. Example for each type of fluids you have to remember, that is for isotonic fluids, 3 example, that is 0.9 NaCl, that is normal saline, RL, ringer lactate, and 5% dextrose. And next one is hypotonic solution. Example is half NS, that is 0.45% NaCl. And example for hypotonic solution is 3% sodium chloride. Okay, dextrose normal saline, 10% dextrose, 25% dextrose, 50% dextrose. Okay, so these are the example for hypotonic solution. So I hope I have cleared all the concept regarding the types of fluids. So thank you very much for patient listening. You will see in the next video with one more topic. So thank you very much for patient listening. Let's see in next video one more class we will discuss in the next video. Okay, thank you very much.